Hello, my name is Dr. Maya Kumar, and I'm an adolescent medicine physician at the University of California, San Diego. This video was produced by the American Academy of Pediatrics California Chapter 3 as part of a larger project for HPV vaccine, provider education, and promotion. Human papillomavirus, or HPV, is the most common sexually transmitted disease in the United States. But more importantly, it is estimated to cause 1 out of every 20 cancers occurring worldwide. Unfortunately, although an effective vaccine against HPV has been available in the United States for 10 years, less than half of American adolescents have completed their HPV vaccination series. In this video, we will outline the burden of HPV-related disease, review general information about the HPV vaccine, discuss common barriers to vaccination, and suggest effective counseling strategies that providers can use to increase vaccine uptake. We will also show you some video clips that demonstrate these techniques in action. As I mentioned before, HPV is the most common sexually transmitted infection in the United States. Almost 80 million Americans are currently infected with HPV, and 14 million new infections occur every year. It is important to point out to patients that unlike some STDs like chlamydia or gonorrhea, which are only contracted by a minority of sexually active people, the lifetime probability of contracting HPV is 85% in women and 90% in men. More than 80% of the population will have been exposed by age 45. Parents and patients need to hear that unlike many other STDs they may have heard of, HPV does not primarily affect people who are engaged in risk-taking behavior. It affects almost all sexually active people, including those in responsible and monogamous relationships. It is also important to note that about half of HPV infections are caused by cancer-causing strains, also referred to as high-risk types. HPV is associated with many different cancers. The most well-known is cervical cancer, of which almost 100% of cases are HPV associated. Despite the widespread employ of routine Pap screening, every year in the USA there are 12,000 new cases of cervical cancer and 4,000 deaths from cervical cancer. Other common HPV-associated cancers include oropharyngeal cancers, of which 70% are HPV-related, anal cancers, of which 95% are HPV-related, penile cancers, of which 35% are HPV-related, and vulvovaginal cancers, of which over half are HPV-related. Although pediatric providers generally focus on the cancers caused by HPV, it is important to note that HPV-related genital warts affect 1% of American men and women at any given time. And while genital warts are not life-threatening, they are still associated with significant morbidity and reduced quality of life. The HPV vaccine has traditionally been thought of as a woman's vaccine because of HPV's association with cervical cancer. However, a sizable burden of HPV-related disease affects men. About 40% of HPV-related cancers in the United States occur in males, and about 2% of all cancers in American men are caused by HPV, compared to 3% of all cancers in women. Men and women are also equally affected by genital warts. In this vignette, the pediatrician clearly demonstrates the need for males as well as females to receive the vaccine. She also draws on her personal experiences with the vaccine to further support her recommendation.
Do you know about the HPV vaccine?
Somewhat, but I don't think it's right for him. I heard it was only for girls, and I don't know enough about it to know how safe it is.
But Mom, I heard from a lot of the guys that they're getting the shot.
Well, Jerem, you're right. A lot of your friends are getting it. Both boys and girls get this vaccination. It's just a part of the routine teenage series. Some people think that it helps prevent cervical cancer, which it does, but it actually helps prevent different types of cancers that affect men, such as oropharyngeal cancers and also penile and anal cancers too. So it actually helps with a variety of different cancers. I have 2 boys myself. I've given them the vaccination. I think it's wonderful. As far as safety goes, I think it's very safe. There's sometimes a little bit of pain when you get the shot, like with most shots, but as far as serious side effects, we're just not seeing those. And so the benefits really outweigh the risks with this vaccination.
There are currently 3 HPV vaccines available in the United States. The 2-valent vaccine only covers types 16 and 18, the most common cancer-causing subtypes, accounting for about 2/3 of invasive HPV-related cancers. The 4-valent vaccine also covers subtypes 6 and 11, which cause over 90% of genital warts. The 9-valent vaccine, introduced most recently, provides coverage for an additional 5 cancer-causing subtypes, which account for an additional 15% of invasive HPV-related cancers. It is a 3-vaccine series, administered at 0, 2, and 6 months. Full completion of the series can sometimes pose logistical challenges, even if a family is willing to get the vaccine. The first HPV vaccine is routinely included in the schedule for 11 and 12-year-olds, but can be administered as early as age 9 years, or as late as 26 years for those who require catch-up vaccination. Adolescents who have already become sexually active may worry that it is too late for them to receive the HPV vaccine. In this video, the pediatrician addresses this concern with his patient.
So it looks like I was just checking kind of your vaccines. It looks like you pretty much had every vaccine except the HPV, and it's something we definitely advise for your age. And I don't know if you were thinking of doing that today, or what do you think?
I know that that's the one that I haven't had, and I was wondering if it was too late for me to get it at this state, because I have recently become sexually active.
It's definitely not too late. Even if you have been sexually active, the vaccine covers multiple strains of that vaccine. It may cover one that you haven't been exposed to yet. It also protects against genital warts, and there are rare cancers in men, both like anogenital cancers in men that it would prevent too as well. So I think it is a good vaccine for you to get for sure. It's a 3-dose series given over about 6 months, so we want you to have like the first the schedule for the second dose before you come back for the first dose.
Unfortunately, the uptake of the vaccine remains very poor among American teenagers. By the end of 2014, only about 60% of adolescent girls and less than half of adolescent boys had received even a single dose of the vaccine. Less than 40% of girls and just over 20% of boys had actually completed the series. In comparison, vaccine coverage during the same period was almost 90% for Tdap and almost 80% for the meningococcal vaccine. Clearly, there are barriers specific to HPV vaccination that need to be addressed. Interestingly, the literature consistently demonstrates that the most important contributor to poor vaccine uptake is lack of a strong provider recommendation, or providers not routinely offering the vaccine at age 11 to 12 years. Compared to other childhood vaccines, providers may give less priority to vaccinating children against HPV if they believe that their younger patients are at lower risk for getting an STD, if they perceive males as being low risk for HPV, or if they present the vaccine as optional to families. The perception of the vaccine as optional may be reinforced by schools not requiring HPV vaccination for entry. In this vignette, the pediatrician does a nice job of addressing a parent's concerns about the safety of a new vaccine.
I took a look at Zoe's immunization record before we came in the room, and it looks like she's due to start the HPV vaccines today.
I'm a little bit concerned about the thought of getting her an HPV shot today. I've done some research myself, and I've seen that people have been passing away from getting the shot, that people maybe aren't able to have children down the road. It's such a new immunization, maybe we should really wait on this.
We've had lots of people with questions about the vaccine. As with any vaccine, it's actually not as new as people think. It was approved 10 years ago, and anytime a vaccine comes to market in the United States, there's lots of studies and research that have been done for years before the vaccine even becomes available to the public. So it's been around for far more than 10 years. There's lots of studies that have been done, not by the company that makes the vaccine, but by other groups. And what they've shown is that there are no side effects with this vaccine any more so than with any vaccine. Except for the one proven side effect is that we are reducing the risks of cervical cancer. And that's really what we're aiming for with the vaccine, is to try and reduce the risk of cancer in these children as they get to be adults.
Many parents and patients worry that giving 3 shots at once at the age 11 visit is too much for the child to handle. And if they perceive from the provider that HPV is not as important as the Tdap or the meningitis shots, they may decline it. Sometimes, even if a family is willing to receive the HPV vaccine, it is a logistical challenge to ensure that they return for completion of all 3 shots over 6 months. Families will benefit from reassurance that even though the HPV vaccine is newer than other vaccines, it was approved 10 years ago, and went through an extensive safety checking process by the FDA before its approval. Many large studies, performed not by the vaccine manufacturer, but rather by independent third-party organizations, have demonstrated no association with serious side effects. Subsequently, over 80 million doses have been used in the United States with no new safety concerns identified. The vaccine does not contain mercury or thimerosal preservatives and does not contain any live viral components. Some patients may experience lightheadedness or syncope after vaccination, but providers can routinely observe patients for 15 minutes after any vaccination to monitor for these symptoms. In this scenario, when a patient is nervous about getting too many vaccines at the age 11 visit, the pediatrician firmly emphasizes that the HPV vaccine is as important as Tdap and Menactra to keep the patient healthy.
Part of staying well is immunizations, and there are 3 we give at this visit. We call them the TDAP, the meningococcal, and the HPV. That sound okay to you?
But Mom, I thought I was only getting 2 shots today.
Dr. Santos, I did tell her she was only getting 2 shots today. Do we really think that 3 is necessary for 1 visit?
I do recommend 3 shots today. They're all very important for your health. The 3rd one, HPV, protects against cancer. So I really think 3 is the standard, it's the recommendation, it's what I recommend.
Well, Dr. Santos, we do trust your judgment on this, and if you think it's the right thing to do for Lucy, then we're willing to do the 3 shots today.
The most critical strategy for counseling about the HPV vaccine is to actively present a strong recommendation for vaccination. Families need to hear that you recommend the HPV vaccine as much as you recommend any other routine childhood vaccine, and that you do not consider it an optional vaccine from a health perspective, even if schools do not always require it for entry. In this scenario, when asked about the purpose of the HPV vaccine, the pediatrician effectively presents it as a cancer prevention vaccine.
Your immunizations are all up to date, except I see that you hadn't started the HPV series yet, and I wanted to get that series started with you today. Do you know anything about that?
Well, our doctor in Pennsylvania said that those were optional, and it's my understanding that the schools didn't require it, so we haven't done those.
Well, actually, it isn't required by California schools right now, but it is highly recommended. And I recommend this shot for all of my patients, both teenage boys and girls.
So why would the HPV shot be important?
Over 33,000 cases every year of cancer are due to HPV, and we could prevent the majority of those cases if everybody just got this vaccination.
You said it's a series of shots?
Yes, it's a series of 3 shots. We can give the first one today. The second one will be 2 months at least from the first one. It can be a little longer if needed, but 2 months after the first one, and then the 3rd shot is 4 months after the second one. And so if we get that started today, we could get her caught up in the next year and she'll be all up to date.
Notice that the pediatrician clearly outlined the dosing schedule for the family and ensured that they received the first vaccine at this visit. When presenting the routine immunization schedule for the age 11 to 12 visit, it can be helpful to mention HPV as the first or second rather than the 3rd vaccine on the list, to further reinforce that it is not optional or an afterthought, but rather prioritized equally with Tdap and the meningococcal vaccine. Back up your own strong recommendations with the endorsements from multiple professional societies, such as the American Academy of Pediatrics and the American Cancer Society. It is also helpful to share your personal experiences with the HPV vaccine. If you chose to vaccinate your own children, if you recommend the vaccine to friends and family, or even if you chose to vaccinate yourself, then sharing that with your patients will give them added confidence that you believe in the HPV vaccine and are recommending it in their best interests. Many parents who associate HPV with genital warts rather than cancer may be understandably concerned or confused about why their 11-year-old child would need vaccination. The most effective way to address this is to emphasize that this is a cancer prevention vaccine, and that all children are at risk of an HPV-related cancer in their lifetimes, even if they do not engage in sexual risk-taking. It can be helpful to quantify how common HPV-related cancers really are. Many parents are eager to vaccinate their children against meningococcal disease, but every year in the United States, there are less than 1,000 cases of meningococcal disease compared to over 25,000 cases of HPV-related cancers. For male patients, it is critical to discuss the types of HPV-related cancers in men against which the vaccine can provide protection. In this scenario, the pediatrician provides reassurance to a patient when she is worried about fainting after the vaccine.
We've talked about the HPV vaccine, and I strongly recommend you do that today.
I really don't want to get it. My friend said it would really hurt.
Well, vaccines can hurt, and you've had vaccines before, so you know there's a quick pinch. I think that the short amount of pain is definitely worth the benefit that it can give you, which is basically to prevent cancer. Now, you had another concern about, you said somebody fainted, right? Did you mention that?
Yeah, my friend told me about someone who fainted when they got it, and that kind of scares me.
Fainting can happen with shots too. It's more common with teenagers than with younger kids. We have a way to prevent that, basically. We have you stay seated when you get the shot and afterward for 15 minutes, or even lie down when you get the shot, and then stay lying down for 15 minutes, and that prevents you from fainting.
Many parents acknowledge the need to vaccinate their children against HPV eventually, but question the need to vaccinate young pre-adolescents before the onset of sexual activity. In these cases, it is helpful to explain the rationale for recommending routine vaccination at age 11 or 12. For any vaccine to be effective, whether it is chickenpox, measles, or HPV, the vaccine needs to be administered well before any exposure to the real disease. It is therefore most effective to vaccinate against HPV at age 11 or 12, specifically because most children have not been sexually active at this age. Additionally, there is now evidence that the efficacy of the vaccine is better when administered at age 14 or younger rather than 15 years or older, because the immune system responds to the vaccine more robustly during this younger age range. Therefore, if a family does intend to vaccinate, the child would get the most immunological benefit from the vaccine if it were administered at a younger age. Parents can also be reassured that studies have shown that the HPV vaccination does not result in adolescents having sex at younger ages. In this scenario, when a parent wonders if his 11-year-old is too young for the vaccine, the pediatrician clearly outlines the rationale for vaccinating at this age.
Everything looks great. Emily's physical was perfectly normal. So today you're just due for a couple of routine immunizations. The immunizations that Emily's due for today are the TDAP, the HPV, and the meningitis vaccine.
Isn't the HPV for when she's a little older?
Actually, all of these immunizations are important for her right now at this age. Specifically, the HPV vaccine is a vaccine that's to prevent cervical cancer from a virus that is transmitted as an STD, which is a sexually transmitted disease. So we're hoping that Emily's not going to really be at risk for that kind of infection until she's much older. But if she gets these immunizations at this age, then she'll have good antibody protection that will help her for the rest of her life.
But can't this wait? She's only 11.
So the studies have shown that kids who get their HPV immunization before they're 14 years old actually make better antibody protection. So it's really important to protect kids against this virus before they ever get exposed to it. It's the same as with many of our other immunizations, like the measles, the chickenpox, the hepatitis vaccines. Those ones, you need to get the vaccine before you're exposed for them to actually protect you.
The pediatrician explained that HPV is a sexually transmitted virus. It might also have been helpful to emphasize that unlike other sexually transmitted diseases, like chlamydia or gonorrhea, HPV affects the vast majority of people who will ever have sex in their lifetimes. It is important for us as providers to remind ourselves that we cannot make any assumptions about when our pediatric patients are going to start having sex. Across the United States, by their 13th birthday, 2.2% of girls, 5.3% of boys, and 3.7% of children overall have already had sex at least once, and the vast majority of this sexual activity was consensual. So as providers, we need to remember that HPV vaccination is recommended at age 11 for a reason, and to avoid deviating from this schedule based on potentially incorrect assumptions about a child's risk. Providers can support completion of the full HPV series by telling families about the dosing schedule ahead of time. An office system for reminders and recalls to complete vaccination, whether by text, telephone, or email, can be enormously helpful for families. For new patients who have forgotten to bring their vaccine records, providers can access the county immunization registry either directly or by linking their electronic health record to the registry. Particularly when seeing adolescents, it is important to include the patient as well as the parent in the discussion about vaccination. Adolescents often have their own questions, concerns, curiosities, and opinions about vaccination, which they should have the opportunity to voice. It is not uncommon for adolescents to want the HPV vaccine, even if their parents have hesitations. Their participation in the discussion may in fact encourage their parents to think differently about the issue. In this vignette, the pediatrician addresses a mother's concerns about vaccine safety gently but firmly.
I've done some research on the vaccine and I have some concerns. I found that somebody has passed away. They've shown that people who get the vaccine may have trouble down the road having children in the future. I feel like the vaccine is just too new. We don't know what all the side effects are and that we really should wait.
I understand your concerns, Mrs. Little. I'm glad you bring them up. I like parents to speak up about their concerns. I haven't myself heard about somebody dying or somebody not being fertile after having the vaccine. It's possible it happened. Sometimes those side effects aren't directly linked to the vaccine. The side effects are no more serious than any other vaccine, basically, that we give. So I feel confident about it, and I would give it to my children. Mrs. Little, I hope I've answered your concerns. Do you have any other thoughts about the vaccine?
I really appreciate you giving me all that information. It's a lot to think about. I have to say I'm not completely convinced yet, but I will definitely think about it, and we can definitely come back another day, I'm sure.
Ultimately, if you cannot convince a parent or patient to accept the HPV vaccine in spite of your best efforts, close your conversation by leaving the door open. Offer yourself as a resource to answer any further questions they might have, and ask for permission to revisit the issue in the near future. Families are usually receptive to this, even if they are not immediately ready to accept the vaccine. We hope that watching this video has given you some helpful background information and some ideas for effective counseling techniques that you can apply to your practice. Thank you for your time.